have diabetes, proper foot care is very important. Poor foot care with diabetes can lead to serious health problems, including possibly having to amputate a foot or leg. It's important to understand the connection between your diabetes and your foot care. As a person with diabetes, you are more vulnerable to foot problems because diabetes can damage your nerves and reduce blood flow to your feet. High blood glucose, a condition associated with diabetes, can cause damage to blood vessels that carry oxygen and nutrients to the nerves. This may impair the nerve's ability to transmit signals throughout the body. Some of the nerves and blood vessels most commonly affected by poor glycemic control are found in the legs and feet. As a result of this decreased circulation and conduction of nerve impulses, diabetics, especially diabetics that don't control their blood sugar levels well, may experience a condition known as peripheral neuropathy, which results in patients not being able to feel sensations in their feet as well. In conjunction with the blood vessel damage resulting from poor glycemic control, patients with diabetes also commonly have compromised immune systems, resulting in a decreased ability to properly fight infections. Thus, the combination of peripheral neuropathy, which results in a decreased ability to sense a trauma to the feet, and a compromised immune system, which makes diabetics less able to fight infections once they do occur, puts diabetics at a high risk for foot problems, such as ulcers shown here. Remember, even though some ulcers may not hurt, every ulcer should be seen by your healthcare provider right away in order to reduce the risk of infections and further complications. Some of the warning signs that you need to be aware of that may signal an infection in your feet or legs include tenderness, swelling, redness, and warmth. If you neglect your foot care, it puts you at a high risk for diabetic foot ulcers. These ulcers may become infected and result in conditions such as gangrene shown here. Complications such as gangrene may require an amputation of the limb. For this reason, it is very important that you work with your healthcare providers to prevent these type of infections. The best way to avoid complications such as foot ulcers and infections associated with diabetic peripheral neuropathy is to utilize prevention techniques. It's important to call or see your healthcare provider if you have any cuts or breaks in the skin, or if you have an ingrown toenail. Also, tell your healthcare provider if your foot changes in color or shape, or if anything starts hurting, becomes numb, or just in general feels different. The feet have several major pressure points, including the heel, the ball of the foot, and the big toe. These are areas of the feet that are most susceptible to diabetic foot ulcers. Pressure points on the foot will change, however, over time as a result of calluses and bunions, which shifts where the foot absorbs the most pressure. Walking on an ulcer can make it worse and force the infection deeper into your foot. As a result of changing pressure points in your feet, it is important that diabetics receive customized shoes that are tailored for their feet so as to avoid pressure ulcers. Your healthcare provider can help size you for a special shoe, cast, or brace as shown here. Diabetics should wear shoes that have a toe box that extends 1/2 inch beyond the end of the toe, a heel compartment snug enough to prevent rubbing, a soft absorbent liner, and a heel which is less than 1 1/2 inch in height. It is therefore advised that diabetics avoid wearing high heels or flip-flops as shown here. You should also not wear shoes that are too loose, too high, or too tight in fitting, as this may also increase the likelihood of the development of diabetic foot ulcers. Some diabetics may also be instructed by their healthcare providers to wear special socks that help to promote circulation within the legs. Also, due to the fact that diabetics are at an increased risk of infection in their feet, you should also avoid walking barefoot, as this may make you more susceptible to foot trauma and infections. It is important that diabetics also continually trim their toenails, as this will decrease their risk of infection. If you have any corns or calluses, your healthcare provider can trim these for you. Also, if you feel that you are unable to safely trim your toenails, be sure to let your healthcare provider know so that they may also trim these for you. Diabetes can cause changes in the skin of your feet because the nerves that control the production of moisture and oils no longer work as well. This can result in the feet becoming very dry, resulting in skin that can crack or peel. It is important that you dry your feet after bathing in order to avoid any potential fungal infections. Diabetics need to check their feet at least once daily to note any changes that may be occurring with them. By inspecting your feet daily and keeping your toes dry, you will be able to decrease your risk of ulcers and infections within your feet. It is also important not to put any oils or creams between your toes. The extra moisture associated with these products puts you at an increased risk of infection. You should also avoid the use of callus pads on your feet as an attempt to improve your feet's appearance, as this may result in more harm than good and put your feet at further risk of infection. If you notice any changes in the condition of your feet, especially if you notice any cuts, ulcers, tenderness, swelling, redness, or warmth, be sure to inform your healthcare provider right away. It is important that you keep your doctor and other healthcare professionals aware of any changes in your foot care so that they can provide you with the best possible care and avoid any preventable complications of peripheral neuropathy. Diabetics should receive annual foot exams, at which time your doctor will check the sensations in your feet using a tool such as the one shown here to monitor the progression or regression of peripheral neuropathy. One of the best ways to prevent the complications of peripheral neuropathy is by working with your team of healthcare professionals to improve the control of your blood glucose levels. The techniques such as counting carbs, eating a portion-controlled diet, and limiting your intake of sugars can help you better control your blood glucose levels. An exercise program where you perform at least 150 minutes a week of moderate intensity aerobic physical activity and do weight training exercises at least 3 times a week has also been shown to improve glycemic control and significantly improve healthcare outcomes. Also essential to properly controlling your blood sugar levels and avoiding any complications of diabetes, including foot ulcers and infections, is proper medication management. Medications and blood sugar monitoring can significantly improve your ability to control your diabetes. By following these guidelines, it is possible to limit foot complications associated with diabetes, ensure that you are able to maintain happy, healthy feet.